Most men know that stress feels bad. That is not a revelation. What most men do not know is what stress is actually doing to their body at a biological level, while they're simply trying to get through their days. Because stress is not just a mental experience. It is a full-body physiological event. And when it becomes chronic, when it stops being a temporary response to a temporary situation and becomes the baseline state of a person's daily life, it begins to quietly dismantle systems inside the male body that most men do not even know are connected to stress. One of the most significant areas where this shows up, and one of the least openly discussed, is in the domain of men's sexual health and overall hormonal wellness. The relationship between how stress and anxiety affect men's sexual health is something that health research has understood for years. But because men are historically reluctant to talk about anything touching on this subject, and because most health content either avoids it or addresses it superficially, the vast majority of men are walking around with stress-driven health changes that they are attributing to aging or bad luck, or just the way things are now. It does not have to be that way, but understanding it clearly is the first step toward actually changing it. Stay with me through this entire video because the section on recovery and restoration contains specific evidence-based strategies that are immediately applicable. And the final piece, the mindset shift that most health content never addresses, might be the most important thing of all. Let us start with the biology, because you need to understand the mechanism before any of the rest of this makes real sense. When the brain perceives a threat, whether that threat is physical danger or a difficult conversation with your manager or a mounting pile of financial worry, it triggers the same fundamental response. The hypothalamus, a small but powerful region at the base of the brain, sends an urgent signal to the adrenal glands. The adrenal glands respond by releasing a cascade of stress hormones. The primary ones are adrenaline and cortisol. Adrenaline is the immediate response hormone. It increases heart rate, sharpens focus, prepares muscles for action, and redirects blood flow toward the systems the body considers essential for survival. This is the famous fight or flight response, and it is extraordinarily well designed for short-term acute threats. The problem is that it was designed for threats that resolve quickly. A predator you either escape or confront. A physical danger that either ends or you do not survive it. The stress response was built for emergencies, not for the sustained, chronic, low-grade pressure that characterizes modern professional and personal life. Cortisol is the longer-acting stress hormone, and this is where things get particularly important for men's health. In small doses, cortisol is genuinely useful. It regulates inflammation, helps manage blood sugar, and supports the immune system. But when cortisol levels remain chronically elevated because the stressors never fully resolve, it begins to function as a disruptive force in the body rather than a supportive one. Here is the specific mechanism that matters most for men's sexual health and hormonal wellness. Cortisol and testosterone share a biological relationship that is largely oppositional. The body treats cortisol production as a higher priority than testosterone production because, from an evolutionary standpoint, surviving a threat takes precedence over reproductive function. When cortisol is chronically high, the body essentially suppresses testosterone production because it is allocating its hormonal resources toward the perceived survival priority. Testosterone is the primary male sex hormone, and its influence extends far beyond what most people associate it with. Yes, it governs libido and sexual function, but it also regulates energy levels, mood stability, muscle mass, cognitive sharpness, motivation, confidence, and overall sense of vitality. When testosterone declines because of chronically elevated cortisol, men do not just experience changes in sexual health. They experience a broad spectrum of physical, psychological, and emotional shifts that collectively degrade their quality of life in ways they often cannot quite identify or explain. This is why so many men under chronic stress describe a cluster of symptoms that seem unrelated on the surface. Persistent fatigue that sleep does not fully resolve, declining motivation, and difficulty finding pleasure in things that used to feel rewarding, irritability, and emotional reactivity. brain fog and difficulty concentrating, reduced physical performance, and yes, decreased libido and changes in sexual function. These are not separate problems with separate causes. They are often expressions of the same underlying hormonal disruption driven by chronic stress. Now, let us talk specifically about how anxiety fits into this picture, because anxiety and stress are related but not identical, and their effects on men's health have some important distinctions. Stress is typically a response to an external pressure or demand. Anxiety is a state of persistent psychological activation that often continues even when the external stressor has resolved or when no specific identifiable stressor is present. Anxiety keeps the nervous system in a state of elevated alert, which means the stress response, including cortisol elevation, continues to operate even in the absence of an obvious trigger. For men who live with ongoing anxiety, the physiological consequences are compounding. The nervous system does not distinguish between a real threat and a perceived one. If the mind is generating anxious thought patterns that signal danger, the body responds as if danger is present. Cortisol stays elevated. Testosterone remains suppressed. The systems that govern energy, mood, and sexual wellness continue to operate under the influence of a stress physiology that never fully switches off. There is also a specific dimension of anxiety that is particularly relevant to men's sexual health, and it is called performance anxiety. This is a form of situational anxiety that specifically arises in the context of sexual intimacy, and it operates through a mechanism that is almost cruelly self-reinforcing. When a man experiences anxiety about sexual performance, that anxiety itself activates the stress response. The sympathetic nervous system, which governs the fight or flight state, becomes dominant, and the physiological conditions required for healthy sexual function depend on the opposite state. They depend on the parasympathetic nervous system, the rest and restore state being dominant. When anxiety activates the sympathetic system, it directly interferes with the physiological processes that healthy sexual function requires. The anxiety creates the very outcome it was afraid of, and the experience of that outcome then deepens the anxiety, which makes the pattern more likely to repeat. This cycle, anxiety interfering with function difficulties, deepening anxiety, is something many men experience, but very few talk about even with their doctors. The silence around it means they do not get accurate information. They often internalize the experience as a fundamental inadequacy rather than understanding it as a well-documented physiological response to psychological stress. And that internalization adds another layer of anxiety and shame that makes the whole picture worse. Understanding this mechanism does not instantly resolve it, but it does something enormously important. It removes the self-blame. It replaces a story about personal failure with an accurate story about biology. And that shift in understanding is where the possibility of real change begins. Let me talk about the nervous system in a little more depth here, because I think this is where the picture becomes most complete and most useful. The autonomic nervous system, which governs the body's involuntary functions, operates through two primary branches. The sympathetic branch is the activation system. It mobilizes the body for action, elevates heart rate and blood pressure, sharpens certain kinds of attention, and prepares the body to deal with threat or demand. The parasympathetic branch is the restoration system. It governs rest, digestion, recovery, immune function, and the physiological states associated with safety, connection, and well-being. Healthy human physiology depends on the ability to move fluidly between these two states, to activate when demands require it, and to restore when the demand has passed. This flexibility is called autonomic balance, and it is one of the most important markers of overall health that most people never hear about. Chronic stress and chronic anxiety erode this flexibility. They keep the sympathetic system in a state of dominance that becomes the new baseline. The body spends progressively less time in the parasympathetic restoration state that it needs for recovery, hormonal regulation, immune function, and yes, for the physiological conditions that support healthy sexual function. Men who live with chronically elevated stress often describe a feeling of never quite being able to switch off. Even in moments that should feel relaxing, the nervous system remains activated. They cannot sleep deeply even when exhausted. They cannot be fully present in moments of connection because the background hum of activation is always there. They feel simultaneously wired and depleted, which is one of the most characteristic signatures of chronic sympathetic dominance. This state has a name in clinical literature. It is sometimes called allostatic load, which refers to the cumulative wear and tear on the body's systems from chronic stress activation. And the research on allostatic load in men is consistent and concerning. High allostatic load is associated with accelerated hormonal aging, increased inflammatory markers, cardiovascular strain, immune dysfunction, mood disorders, and significant declines in the hormonal and physiological markers that support men's sexual health and overall vitality. Now, I want to address something that the research shows clearly, but that men's health culture rarely communicates directly. These changes are not inevitable. They are not simply the price of being a driven, responsible adult in a demanding world. They are the result of specific physiological patterns that respond to specific interventions. And many of those interventions are accessible, evidence-based, and do not require medication or radical lifestyle overhauls. Let me walk you through what the evidence actually supports. The first, and perhaps most foundational intervention, is sleep. I know that sounds like something people say and then ignore, but I want to give you the actual mechanism so you understand why this is not a soft suggestion, but a hard biological necessity for men's hormonal health. The majority of testosterone production in men occurs during sleep, specifically during the deep, slow-wave sleep phases and during REM sleep. Studies consistently show that men who sleep fewer than 6 hours per night have significantly lower testosterone levels than men who sleep 7 to 9 hours. One landmark study found that a week of sleeping 5 hours per night reduced testosterone levels in young, healthy men by 10 to 15%. That is a decline comparable to aging 10 to 15 years in hormonal terms, produced in 7 days by sleep restriction alone. Chronic stress directly degrades sleep quality through multiple mechanisms. Elevated cortisol in the evening, when cortisol should naturally be at its lowest, interferes with the ability to fall asleep and stay in the deep restorative phases. Anxious thought patterns that activate at night keep the mind in a state of arousal that prevents the nervous system from fully down-regulating into the sleep states where hormonal restoration happens. Addressing sleep is therefore not separate from addressing men's hormonal health. It is central to it. Practical steps that the research supports include maintaining a consistent sleep and wake schedule even on weekends, which anchors the circadian rhythm that governs cortisol and melatonin timing. Reducing light exposure, particularly blue spectrum light from screens, in the 2 hours before sleep. Keeping the sleep environment cool, dark, and genuinely quiet, and establishing a consistent wind-down practice in the pre-sleep period that signals to the nervous system that the activation phase of the day is genuinely over. These are not revolutionary suggestions, but the consistency with which men who implement them report improvements in energy, mood, and hormonal markers within weeks suggests that most men are significantly underestimating the impact of their sleep habits on their overall health. The second major intervention is physical movement, and the specific type matters. Exercise is one of the most reliably documented methods of both reducing cortisol over time and supporting healthy testosterone levels. But the relationship between exercise and stress hormones is nuanced and worth understanding clearly. Resistance training, the kind that involves lifting challenging weights in a way that genuinely taxes the muscles, is one of the most potent natural stimulators of testosterone production. Multiple studies have documented acute testosterone elevations following resistance training sessions, and consistent long-term resistance training is associated with higher baseline testosterone levels in men across age groups. However, the relationship between exercise intensity, volume, and stress hormones is not simply more is better. Excessive exercise volume without adequate recovery, sometimes called overtraining, actually elevates cortisol chronically and can suppress testosterone rather than support it. Men under significant life stress, who then add very high volumes of intense exercise without sufficient recovery, may actually compound their hormonal disruption rather than resolving it. The practical implication is this: 3 to 4 sessions per week of genuinely challenging resistance training, combined with adequate protein intake and sufficient sleep for recovery, is one of the most evidence-supported natural supports for men's hormonal health. Complemented by regular lower-intensity movement like walking, which has its own well-documented cortisol-reducing effects without adding significant stress load to the system. A particularly interesting finding in the research is that time spent in natural environments, what some researchers call green exercise, walking or exercising outdoors in natural settings rather than indoors, produces significantly greater reductions in cortisol and stress markers than equivalent exercise indoors. If you have access to parks, trails, or any natural outdoor environment, using them regularly is a genuine health investment. The third intervention is nutritional and hormonal support through diet. The relationship between diet and men's hormonal health is an area of active research, with some findings that are well established and some that are still emerging. I will focus on what is clearly supported. Chronic stress and elevated cortisol are associated with increased insulin resistance, changes in appetite regulation that favor high sugar and high fat foods, and depletion of several micronutrients that are important for testosterone production and stress resilience. Zinc is one of the most well-researched micronutrients in relation to testosterone in men. Zinc is directly involved in testosterone synthesis, and zinc deficiency is associated with reduced testosterone levels. Good dietary sources of zinc include red meat, shellfish, particularly oysters, which are remarkably zinc-dense, legumes, seeds, and nuts. Men under chronic stress may have higher zinc requirements because stress increases urinary zinc excretion. Magnesium is another mineral with consistent research support for its role in stress resilience and hormonal health. Magnesium is involved in over 300 enzymatic processes in the body and plays a role in regulating the nervous system's stress response. Magnesium deficiency, which is common in men eating typical Western diets, is associated with elevated cortisol, disrupted sleep, and reduced testosterone. Dietary sources include dark leafy greens, nuts, seeds, legumes, and dark chocolate. Vitamin D, which functions more like a hormone than a conventional vitamin, has a well-documented relationship with testosterone levels in men. Studies have found associations between vitamin D deficiency and lower testosterone, and supplementation in deficient men has shown testosterone-supporting effects. Given that vitamin D deficiency is extremely common, particularly in men who work indoors, this is worth discussing with your doctor and potentially having your levels tested. From a broader dietary standpoint, the pattern most consistently associated with hormonal health and stress resilience in men is one that prioritizes whole unprocessed foods, adequate protein for muscle support and satiety, healthy fats including those from olive oil, avocados and fatty fish, and a wide variety of vegetables providing micronutrients and fiber. The dietary pattern most associated with hormonal disruption is one high in ultra-processed foods, refined sugars, excessive alcohol, and insufficient protein. Alcohol deserves specific mention because its relationship with men's hormonal health is often underestimated. Alcohol directly suppresses testosterone production and elevates cortisol. Chronic heavy drinking has well-documented effects on men's hormonal profiles and sexual health. But even moderate drinking, particularly when it becomes the primary stress management strategy, which is extremely common in men, maintains a chronic, low-grade hormonal disruption. If alcohol is your main way of managing daily stress, replacing it with more effective stress regulation strategies will have measurable hormonal and health benefits relatively quickly. The fourth intervention is direct nervous system regulation through mindfulness and breath work. I want to address this one carefully because I know that for many men, terms like mindfulness carry associations with approaches that feel either soft or irrelevant to their actual situation. So, Let me frame this in terms of the mechanism, because the mechanism is unambiguous. Intentional, slow diaphragmatic breathing, specifically the kind that extends the exhale longer than the inhale, directly activates the parasympathetic nervous system through the vagus nerve. This is not a metaphor. It is a measurable physiological response. Slow, extended exhalation, breathing, reliably reduces heart rate, lowers cortisol acutely, and shifts nervous system balance toward the parasympathetic restoration state. The practical application is simple. A breathing pattern of inhaling for 4 counts, holding briefly, and exhaling slowly for 6 to 8 counts, practice for 5 to 10 minutes, produces measurable changes in heart rate variability and stress hormone markers. This is a tool you can use anywhere: at your desk before a difficult meeting, in your car before walking into a stressful situation, in bed when you cannot switch your mind off at night. The broader mindfulness research in men's health shows that regular mindfulness practice, even 10 to 20 minutes daily, is associated over time with reduced baseline cortisol, improved sleep quality, reduced performance anxiety, and improvements in the psychological dimensions of sexual health and well-being. The men who stick with it long enough to experience these benefits consistently report that it was not what they expected, not passive or abstract, but a genuine and practical tool for managing the physiological stress load that was quietly degrading their health. The 5th intervention is social connection and the willingness to seek support. This is perhaps the most culturally loaded intervention for men because it runs directly against some of the deepest conditioning that many men carry about self-sufficiency, stoicism, and the idea that needing support is weakness. The research on social connection and men's health is unambiguous. Social isolation is one of the strongest predictors of poor health outcomes in men, including elevated cortisol, accelerated hormonal decline, increased cardiovascular risk, and significantly higher rates of depression and anxiety. Men with strong social support networks, meaning genuine connections where they feel they can be honest about their experience, have measurably better hormonal profiles, better cardiovascular health, and better mental health outcomes than socially isolated men. The problem is that many men's social connections are functionally supportive in practical terms, but not emotionally nourishing. They have people they can call for help with a task, but not people they can call when they are struggling internally. And the absence of the second kind of connection leaves a real gap in the social and psychological resources that protect men's health under stress. Building these kinds of connections requires some willingness to be more honest than men are typically encouraged to be. To say to another person, "I have been struggling with this, and I have not talked about it," that kind of honesty is uncomfortable. But the research on what it does for men's stress physiology and overall well-being is compelling enough that I want to name it directly as a genuine health intervention, not just an emotional preference. And in the specific context of men's sexual health, the willingness to speak honestly with a partner about what you are experiencing is itself therapeutically significant. Partners who understand that their partner's changes in sexual interest or function are stress and anxiety related rather than relational or personal tend to respond with more support and less distress. And that relational support itself reduces the anxiety component of the picture, which is one of the most important contributing factors to the pattern of difficulties many men experience. If the stress and anxiety affecting your health feels significant and the self-directed strategies are not sufficient, please speak with your doctor or a qualified mental health professional. This is not a failure. This is the intelligent and responsible response to recognizing that your health needs support beyond what you can provide for yourself in that moment. A primary care physician can assess your hormonal levels, rule out other contributing factors, and discuss evidence-based options for support. A therapist who works with men's health, particularly one familiar with cognitive behavioral approaches to performance anxiety, can provide specific and effective tools for addressing the psychological dimensions of what you are experiencing. And there is no shame in any of this. Seeking accurate information and appropriate support for your health is what intelligent, self-aware men do. I want to address one final element before I bring this all together, because I think it is the piece that makes all of the practical strategies either work or fail, depending on whether it is in place. It is the question of how men relate to their own health experience. The dominant cultural script around men and health in most societies has historically been one of endurance. Push through. Do not complain. Handle it. Showing physical or emotional vulnerability is weakness. And men internalize this script so deeply that they often do not even recognize when they are enacting it. They notice symptoms and minimize them. They know something is off and wait to see if it resolves on its own. They feel the effects of chronic stress on their body and attribute them to anything except what they actually are. This orientation toward their own health experience costs men enormously. Men visit doctors less frequently than women. Men are significantly less likely to seek mental health support. Men wait longer before addressing health concerns that have progressed to the point of causing real harm. And the specific area of men's sexual health carries an additional layer of cultural stigma that makes open conversation and help seeking even less likely. The shift that I want to invite is not dramatic. It is simply this. Begin treating your own health experience with the same interest and care that you would bring to anything else in your life that genuinely matters to you. When you notice something is not right, treat that as information worth taking seriously rather than something to override or ignore. When the information points toward needing support, access that support with the same pragmatism you would bring to any other problem that requires expert input. Your health is not separate from your life. It is the foundation everything else is built on. Your energy, your relationships, your capacity to be present and engaged and genuinely alive in your own experience. All of it runs on the foundation of your physical and psychological health. Protecting and restoring that foundation is not indulgent. It is essential. Chronic stress and anxiety are powerful forces. Their effects on men's sexual health and overall hormonal wellness are real, measurable, and significant, but they are also responsive to real, evidence-based, consistently applied interventions. Sleep, movement, nutrition, nervous system regulation, honest social connection, and the willingness to seek professional support when needed. These are not soft suggestions. They are the actual tools that shift the actual biology. You deserve to feel well, not just functional, not just getting through, actually well, energetic and clear and connected to your own life in a way that feels alive rather than managed. That is what restoring your health from the effects of chronic stress can give you. And it starts with understanding clearly what is actually happening in your body and making the decision to take it seriously. If this video gave you useful and honest information today, please share it with a man in your life who might need it. The men who need this information most are often the least likely to look for it. Your sharing it might be what reaches them. And if you want to keep learning about men's health in a way that is evidence-based, honest, and genuinely useful rather than sensationalized, subscribe to this channel, because this is exactly the conversation we are committed to having every single week.